Azul Cosmetic Surgery and Medical Spa. We are so happy to welcome back to the show this morning Dr. Patrick Flaherty. Good morning.
Good morning, Carly.
All right, we're going to talk about aging this morning. Unfortunately, it happens to all of us. And we're going to kind of talk about aging between the decades and maybe when some people come in to see you and maybe kind of figuring out when the right time to do some things, right? Because I think it's all about timing, right?
Yes, well, it is. It's, you know, what's appropriate at that age for that patient, you know.
Well, let's talk about, what's the youngest that people are generally coming in to see you?
Oh, you know, I mean, believe it or not, you have parents bringing their teenagers in sometimes. But some of that's just for skincare, for acne.
Which we do, that's a great thing that you're able to help with that as well. But generally, if they're wanting some fine lines and wrinkles and they're just not happy with how they're looking these days.
Yeah, I think, you know, in the 30s and 40s is when we start to see people a little more frequently, you know, for Botox, you know, they start to get smile lines or frown lines between the brows and come in to talk about Botox, which is a great treatment for those early signs of aging, the early creases on the face.
Okay.
You know.
And then, and I think we have, let's go ahead and start with our youngest patient here this morning. That's a good example. You say she's in her early 40s. She looks pretty good.
She looks great. She has beautiful skin naturally, of course. But if you look at the face on the left to the right, you can see the face on the left, she looks very thin compared to the right. And this is what we call our liquid facelift, which is usually a combination of Botox products and fillers. So she had Botox for between the eyebrows, forehead, and around the eyes. And then fillers are really the most profound change. They're used to lift the eyebrows. You can see the eyebrows are a little higher and a little more arched. And to fill the cheeks, so a mid-face lift or a cheek lift, you can see the cheeks look a little flat on the left and more full and youthful on the right. And then the jawline and around the mouth, you can see also she almost has a little jowls before the treatment, and just by filling in those areas, we've tightened and lifted the face and filled in some of the hollowness, which makes her face look much younger.
And we've talked about before how adding volume is really important, you know, in that aging process and kind of returning that youthful glow. We kind of forget about that sometimes.
That's right. That's right. It can do wonders, and it can be done just in the office with injectables.
Awesome. All right, so moving up in age just a little bit.
So she's actually in her early 60s, which is hard to believe when you look at her post-treatment.
She looks good.
But the testament to here is make good care over many years and appropriate surgery when the time is right. So she practiced skincare, injectables, Botox fillers. The slide on the left was before really anything. And then on the right, recently she had a facelift, which was appropriate at that age. Her face looked really good, but she noticed the jowling and neck laxity. So we did a face and neck lift, which has really helped everything match together.
What is the peak age for a facelift, do you think?
The best ages are 50s and 60s because you're still, you know, in good condition, and, you know, that's when you start to see the laxity. Although that being said, we have a lot of patients coming in their 70s for first-time facelifts because we're living longer and we're more active. So I think we're seeing that age change a little bit.
How old is this particular woman? She's looking good in her after.
Yeah, she was in her 60s at the time, but a lot of sun damage. So we did an upper eyelid surgery and a laser to tighten the skin, and that's 2 months out, showing the tightness and smoothing of the skin. And so laser can be really helpful for people with bad sun damage to tighten and smooth the skin and get rid of that.
That was remarkable to see, you know, the smoothing.
It is remarkable. It's a transformation. We did a patient yesterday, and she's going to look 20 years younger just by rejuvenating the skin with the laser. So, yeah, it's...
As people are watching this morning and they're thinking, you know, we talk about the, you know, technology getting so much better than what it was, you know, maybe 10, 15 years ago, and all the different options that are available. What do you want people to know when they're maybe considering, okay, I'm ready to do something a little bit more? How do they know what they're ready for? What do you...
Yeah, it's changing really fast, but the good news, there's something for everybody. That's the important message, whether it's just skincare, which is, you know, completely non-invasive with no downtime, or our light lasers, to the injectables, which have minimal downtime, to surgical procedures, which are now faster and less downtime and quicker recovery. There really is something for everybody. So coming in for a consultation is a good place to start. We usually outline all the things that can be helpful to a patient because everybody's different. They may not be ready for surgery yet, but there's a lot of things we can do non-surgically. So once you know all the options, then you can find a path that makes sense for you.
And what I love is there's 2 pathways to get to your offices. You have 2 offices here in Southwest Florida, so it makes it so easy for people to really find you from anywhere here in Southwest Florida to come in for that consultation. right?
Right, yeah, in Bonita, which is really Coconut Point, right across from Coconut Point, and then here off Daniels in South Fort Myers, yes.
So come in, see Dr. Flaherty, get that consultation, and see what new technology and a great doctor, how they team up, what they can do for you. It's exciting stuff.
Well, a great team. We have a great team of people.
You do. Yes. Dr. Flaherty, thank you so much. We love having you here. We look forward to having you back.
Good to be here, Carly.
And certainly for more information on his office or wherever his offers are right now, just head to our website, fox4morningblend.com. And speaking of offers, for this month you can get $100 off of Botox products and fillers with nurse injector Britton Stein. So make sure you call and take advantage of that.
And ugly ties for a great cause. We celebrate dads and dogs at an all-new Yappy Hour that's coming up next.